Welcome to DM Neurology Made Easy. This is the 21st episode of Fine Neurophilia Quick Revision Series. Let's see the Parkinsonism Part 2 video.
So this we have seen. So just we need to know more about this. Actually, till now we were studying. If you see Harrison and all, you were studying basically two circuit. If you are asked about the circuitry, we will be thinking of direct pathway and indirect pathway. But that's not the true thing. We have actually 5 circuits, that is 5 loops and 3 divisions, and they pass through putamen, caudate, and the striatum. That all you need to know, because that is actually changing. That is actually new concepts. So direct pathway is pathway which occurs from the striatum to the globus pallidus interna, direct pathway. And what passes from striatum to globus pallidus externa, then reaches the interna, is otherwise called as the indirect pathway. So now we are taking step into what you think is a bit tougher one. That is actually what is called as the circuit, what you had studied as a circuitry. Blue arrow is actually glutamate. So glutamate is actually excitatory. So it stimulates, it's positive. And whatever I have shown in the red arrow will be GABA. So it is inhibitory. And whatever I have shown in black will be dopamine. So dopamine. So these are basically these three are the neurotransmitter which we'll be discussing in case of Parkinson's disease. So not much: GABA, glutamate, and dopamine. So let's try what happens in brain. So what is cortex doing is trying to make us move by the sensory stimulus which we are getting. So that is basically by the motor cortex. So basal ganglia is trying to manipulate this by either by making it very smooth. So how it does? So for that itself, cortex has to give the input to the basal ganglia. So cortex give the input to the striatum. Striatum, as we know, is a combination of what actually it's a combination of caudate and the putamen. So striatum is caudate and putamen, and not substantia nigra. It's caudate and putamen. So cortex gets input from striatum, and striatum has a input to the globus pallidus interna, and there is actually globus pallidus interna, the lens like thing we had seen previously. So the lens, the inside part, globus pallidus interna. So these are actually not far away. These are actually nearby only. So what we are talking as striatum is actually the caudate plus putamen, and globus pallidus interna is inside, externa is just here. This is externa. So what we are talking is actually cortex gives some stimulus from cortex to caudate and putamen, that is striatum. That is positive stimulus. And what happens is this striatum gives inhibitory stimuluses to the interna, which is actually similar to what is there in the substantia nigra. Substantia nigra, pars reticulata. Substantia nigra, that is within the midbrain, has got that substantia nigra in the midbrain has got 2 parts. That is substantia nigra compacta and substantia nigra reticulata. So don't confuse much. Substantia nigra reticulata R, SNR, is almost similar to what we see here in globus pallidus interna. So we together write it like this. So remember, cortex, if you are for this will be helpful for your theory also for the final years. Cortex, striatum, GPA, SNR. So this finally goes into what is called thalamus. So what thalamus does is actually, thalamus is actually stimulates the cortex. Thalamus tells the cortex to move, or usually gives a positive impulse. So good thalamus with the help of glutamates ask the cortex to move. So this is actually what is called the direct pathway. Striatum to globus pallidus interna, which is inhibitory stimulus. Then from there, inhibitory to thalamus to cortex. So what the striatum actually does is actually inhibition to inhibition, double inhibition. So that is actually striatum disinhibits the thalamus. So if striatum in this pathway, what it does is it indirectly activates the thalamus to make the cortex move. So striatum, if it activates, it causes inhibition to globus pallidus interna. So it is inhibited. So this negative thing won't happen. So thalamus is free to act, and it produces a positive impulse. It is able to generate a glutamate release and cause cortex to act to produce a movement. So that is actually happening in direct pathway. So it is actually facilitatory to cortex. That is, so no confusion, direct pathway facilitates the thalamus. In turn, in normal persons, the striatum actually in direct pathway, it facilitates the thalamus and in turn facilitates the cortex. So what happens in indirect pathway is actually it inhibits the globus pallidus externa, which in turn inhibits the subthalamic nucleus. So same thing what we were talking here actually. So this subthalamic nucleus is actually disinhibited. So subthalamic nucleus is able to produce a positive stimulus to the globus pallidus interna. So this is able to act on itself, and it is able to produce a negative signal here. So there is a balance between this direct pathway and this indirect pathway. So there is a balance between this direct pathway and indirect pathway, so that an impulse is actually in a normal person, this direct pathway and indirect pathway acts normally to produce a normal smooth movement. So what happens in Parkinson's disease is actually, so this is actually direct and indirect pathway. So on top of this, there is something called, what we are talking is actually, there is one more thing actually, there is actually D1 and D2 receptors in the substantia nigra, which further controls these movements within the striatum. So as you told, direct, first of all, just remember that direct pathway is facilitatory to thalamus, and indirect pathway, because this globus pallidus interna is activated by the subthalamic nucleus because of disinhibition, is because this is disinhibitory, globus pallidus interna will inhibit the thalamus. So this is actually inhibitory. Indirect pathway is inhibitory to thalamus, so less movement. So there is a fine balance. This is further monitored by the substantia nigra. Hope you understand this. Very difficult. I try to simplify it. Hope you are not further confused. So this is a concept I want you to make clear of. Hope I can tell you once more. So cortex, striatum. So globus pallidus interna and SNR, both are homologous. Thalamus. So striatum is disinhibitory to thalamus. So thalamus can fire normally to produce a cortical activity. In indirect pathway, disinhibits the subthalamic nucleus, so acts on the GPE, and actually thalamus is actually, this is actually a fine balance is maintained with direct and indirect pathway. Substantia nigra is actually kind of a policeman. It has two hands. So D1 hand will actually facilitate the direct pathway. That is, with D1 it will facilitate the direct pathway here, D1, and D2 will inhibit this pathway. So balance is maintained in a case of a normal person for a smooth movement. In case of that is why we don't have any extrapyramidal problem. But what happens is in Parkinson's disease, this is lost. So that I'll tell you in the next slide. Parkinson's disease, we know that the problem is actually there in the dopaminergic neurons within the substantia nigra. Substantia nigra. The substantia nigra is here in the midbrain. Dopamine. So hope I think you are clear. So direct pathway. This is actually just Bradley. What I have told. If you after seeing this slide, just try to go through Bradley, or even Harrison has got a picture of this. Try to go through this. So one more thing, this was asked in recent NIMHANS. There is one more pathway, that is hyperdirect pathway. So that is actually direct connection from cortex to subthalamic nucleus. What we are talking is actually direct connection positive. That's actually positive glutamate connection from cortex to subthalamic nucleus. So direct, indirect, and direct pathway. These are the three pathways. At least if you didn't understand any of this, three pathways are there. Hyperdirect, which is positive. Indirect and direct is actually negative, inhibitory pathways. So, but for thalamus, this direct pathway is disinhibitory, double negative, so it's positive, negative plus negative. So negative plus negative, so it happens to be positive to thalamus, and negative plus negative is positive here, but here it's positive, but here it becomes negative. So it is inhibitory. Finally, it is inhibitory. So indirect pathway is inhibitory to thalamus, but direct pathway is positive to thalamus. So that is actually, and hyperdirect pathway is always positive. So that at least you need to understand. So 3 pathways: hyperdirect, indirect, and direct. I'm repeating it so that at least when you read it, you get a hint of what I am talking about. So, so that is one thing. Okay. So what happens in Parkinsonism? So we were talking about all these pathways, direct. Now, this is not to think that you have got bored. This is actually an animation to show that this is a case of Parkinsonism with less of dopamine, so less of energy. Dopamine is also concerned with energy and depression. So substantia nigra is affected. So as you know, substantia nigra is affected. So D1, the black arrows are actually dopamine. D1 is lost, D1 is decreased, but D2 is increased. So there is an imbalance. So D2 is increased. So what happens is actually there is an inhibitory thing to the globus. So direct pathway was an inhibitory. So you remember that there was a thick arrow of inhibition to globus pallidus interna. Now that because that facilitation to that thick arrow is lost, there is less of thick arrow. There is small thick arrow, so less inhibitory. So now you know that inhibition from globus pallidus to thalamus is lost. So globus pallidus interna is able to inhibit the thalamus more in Parkinson's disease. So now it is unable to fully able to stimulate the cortex to produce energy, means to produce movement. So in direct pathway, it is unable to fully act. So disinhibition to thalamus is lost and thalamus is inhibited more, and the patient is tired or is extrapyramidally is actually bradykinesia. Bradykinesia is there, and that is reflected here. So what happens to indirect pathway? Indirect pathway, what happens is actually there is more of inhibition, more of inhibitory to globus pallidus externa. That means more inhibition to globus externa means there is actually less inhibition to subthalamic nucleus. So that disinhibition to subthalamic nucleus is lost. So more positive. So more positive to globus pallidus externa means interna means what happens? There's more. It is getting more energy in globus pallidus interna. So what happens? More negative energy to thalamus. So further, what happens? There is actually less energy. What I meant to say was that less energy. So this is what happens in Parkinson's disease. So that is what I was trying to tell. I'll tell you, I will show you the animation once again. I think it's pretty clear. So what happens in Parkinson's disease is actually because of damage to substantia nigra, dopaminergic pathway, dopamine D1, which is facilitatory, is decreased. But in D2, actually D2, it's increased actually. So GPI disinhibition to thalamus is lost. So thalamus is inhibited, and hence cortex is unable to produce an increased movement. And in case of indirect pathway, what happens? Actually more this thing, inhibitory effect is there. So that causes disinhibition to subthalamic nucleus is lost. So subthalamic nucleus is able to produce more of positive input to globus pallidus interna, which now produces more of negative input to thalamus, and thalamus is further producing a kind of a bradykinesia. So that is what happens in Parkinson's disease. So I think you're pretty clear, because I made this animation myself to make sure that you are getting the crux of it. So what happens in hyperkinetic movement disorder is actually just the reverse. So thalamus is actually not inhibited. So it is able to produce more movement. But on the other side, subthalamic nucleus is inhibited more, so less. So what happens now? So this arrow becomes further thin, so more of activity to cortex. So it is the sphere is highly active, hyperactive. So that happens in Korea. This is actually the recent concept which is being followed, and so there is more activity. So in Parkinson's disease, what happens is actually there is increased activity in actually the subthalamic nucleus as well as the globus pallidus interna, as you can see. So deep brain stimulation is actually occurring here. There is being done in subthalamic nucleus and globus pallidus interna. So deep brain stimulation, what we do is actually you introduce electrodes here, these two regions, because these are the areas with higher activity. So that this occurs in Parkinson's disease. Hope you got the concept clear. So that was regarding hypokinetic and hyperkinetic movement pathway. So next time you see a pathway like this in a book, don't get worried. You can try to make it simplify. Actually, this was the box on the top. This was actually the box on the top, cortex. Whole cortex was what I had written in the box was here, cortex. This was actually the striatum, which there was the second box. If you see, go back and see. This was the controller traffic police. That is the substantia nigra pars compacta. And this was actually the indirect pathway, which was on the right hand side. And this was the direct pathway, which I had written. Don't confuse this. GPA and SNR are homologous. They will be written in a single box. Don't confuse. And these all nucleus are single nucleus. Remember, as just thalamus. Don't confuse much. Okay. So next time you see some kind of this kind of a picture, try to simplify and learn. I think seeing this video again and again would be more than enough. Please give a feedback of how much you understood from this. Which of the following is an incorrect statement? So if you have understood this, please try to answer this question. So GPA and SNR, they are homologous. Sends an inhibitory outflow to the thalamus. Sends an inhibitory outflow to the thalamus. That is true. We had seen, right? Actually, red arrow we had seen. That is GABA. So that is true only. So it is not a wrong statement. Second statement is globus pallidus externa sends an excitatory projection to subthalamic nucleus. Globus pallidus externa, yes, that is on the right side. Yes, excitatory projection to subthalamic nucleus. No, it is actually inhibitory. That side also was actually red only, GABA. So that is the wrong answer. So net effect of indirect projection is disinhibition of subthalamic nucleus. True. Yes, because two double arrows comes, so positive. So disinhibition of subthalamic nucleus. True. In the same way, in direct pathway, there is disinhibition of the thalamus. That MCQ also could come. Activity in the indirect pathway that excites the GPA and SNR. That is also true, because subthalamic nuclei will excite the GPA and SNR. So that is also true. So now if you have understood the pathway, any MCQs in that regard, any neurotransmitter being asked can be answered with ease for you. So that is why I took time on that, because it's very difficult for anyone to, for you to understand that. Hope you got that correct. So yes, most of them have answered it correct. I'm really happy that my efforts have paid, were fruitful. So I'm quite relieved. So next question is, what is a neurotransmitter? So now it's quite easy for you. So I think any question from this part, I think all should answer it correctly. So what is a neurotransmitter involved in the pathway of basal ganglia circuitry between cerebral cortex and striatum? Simple, straightforward question. Nobody should make a mistake. I have told you about the arrows. Only 3 arrows we need to know: black, red, and blue. Rest, a table is there in Bradley in which more neurotransmitters are there. Don't worry. At least these you don't make mistake, because these are basic. So next question is actually similar question only. What is the neurotransmitter in the pathway between subthalamic nucleus and globus pallidus interna? Subthalamic nucleus and globus pallidus interna. subthalamic nucleus to globus pallidus is actually a horizontal line, which is actually excitatory. So excitatory is actually glutamate. What is the neurotransmitter involved in the pathway between GPI and thalamus? Simple, straightforward question. In FTG PET of a patient with extrapyramidal syndrome, the patient was having an extrapyramidal syndrome. It was found that there is a decreased activity in the GPI. That is, globus pallidus interna was having a decreased activity with increased activity in the thalamus. So which one of the following is the least likely diagnosis? Now, having studied all the pathways, you had seen which of the following, what happens in what all, which of the following are excited, which of the nuclei are excited and all we have seen. Actually, in GPI, what happens in Parkinson's disease and in subthalamic nucleus, what happens in GPI is actually, there is increased activity. And in thalamus, actually, there is decreased activity. That is why there is actually, so that's what I was talking about. GP and subthalamic nuclei will be having increased activity in Parkinson's disease, and the thalamus will be having decreased activity. This is a word in Harrison. So don't just by heart. This is actually the concept. Because you have studied this pathway, it's pretty clear that this is what reverse of what happens in PD. So this is how we differentiate essential tremor and others from PD, if you have a doubt.